so much, Sylvia, for the opportunity to speak this afternoon. It's a really lovely opportunity for Dave and I to present together. We both work as part of the NIHR Policy Research Unit in Behavioural Science, where we're very lucky to have a dedicated group of PPI. So PPI is really integral to all the research that we do. And so it's a little bit different to having a standalone project, if you like. But for the purposes of today's discussion, we're just going to focus on a study that we conducted last autumn, where that sought to understand people's decision-making about having a COVID-19 booster vaccine. So I'll begin by giving a little bit of background to the study and my perspectives of the value in working together with the PPI group on to kind of conduct this study in the rapid way that we were required to. And how we hope to continue that involvement in future research, and then pass over to Dave, who will talk about his perspectives and give a little bit more background to how PPI works within the Policy Research Unit. Next slide, Sylvia. Okay, so when we started planning this work kind of the end of summer last year, it was very clear, of course, that COVID-19 was going to continue to pose a significant risk to public health for quite some time. And also at the time, there was research emerging internationally that vaccine effectiveness may start to wane in that kind of 4 to 6 month period after people were completing the primary course of the vaccine, which led governments all over the world to roll out booster vaccine programs, including here, of course, in the UK. But like any vaccine program, the booster vaccine program was only going to be successful if people made the decision to have the booster and of course then follow through with their decision. Next slide. So this research was really born out from another study that we had done within the unit, and again where we worked very closely with our PPI group. And in this previous research, we found that people who are vaccine hesitant are at different stages of decision making, and therefore it might be that there would be benefit to more tailored public health messaging that can really kind of address the specific needs of different cohorts of the publication, depending on where they were in their decision-making process. And in order to conceptualize this decision-making, we referred to the precaution adoption process model that was developed by Weinstein, a health psychologist, quite some years ago now. And essentially they conceptualize or envisage people transitioning through a number of different stages when presented with a novel threat to health, from being completely unaware that the threat is there to deciding to take action to help prevent the threat, in which case, for our purposes, we're talking about vaccination. Next slide. Okay, so I'll just cover this really quickly so that we can move on to the how PPI were involved. But essentially the aims of this study were to profile the general public's decision making about having a COVID-19 booster vaccine by stage of decision making, and then to examine associations between decision making and individuals' experiences of receiving their first and second COVID-19 vaccines, their attitudes and beliefs about COVID-19 booster vaccination, as well as personal health characteristics and socio-demographic characteristics. In order to be eligible, participants needed to live in England, be fully vaccinated and be 50 years of age or older. Remembering that last autumn when the booster vaccine program was rolled out, that was the eligibility criteria at the time. So we conducted this research about 4 weeks after the booster program started, so in the first half of October last year, and all participants were asked to complete an online survey. Next slide. Okay, and so PPI was really was important for loads of reasons, really. And as I said, this project actually stemmed from a previous research that we did within the unit, actually in December 2020. I'm just trying to think back there. And so PPI has been integral right from the beginning in this line of work, really. But in terms of this particular study, we obviously wanted PPI input into participant information to ensure that when this project was getting presented to potential participants, that the information was easily digestible, easy to understand, and so we got loads of really helpful practical input, really, about you know, terms that were jargonistic that we missed, things like that, making sure that the title was appealing and simplified, that type of feedback. Then, of course, we required feedback. We asked the PPI group for their perceptions of survey wording and the scales that we used within the survey, where we got really helpful feedback regarding, you know, when extra response categories might be required, you know, whether or not the scale was moving in the same direction all the time, where positive indicators were always on the right, etc. And then, of course, because the survey was being delivered online, we wanted to ensure that it was easy to navigate, and so we wanted to check, we had further PPI involvement in trialling the survey and giving us really useful feedback on whether or not they could use it on different platforms, whether or not the font was large enough, whether or not the text was easy to understand, and whether or not it was too cumbersome to be involved. And then, of course, after the study was completed, we had the opportunity to feed back to the PPI group and actually get their take on what the data was telling us. And I think this was particularly useful. It was helpful to help make sense of the data, if you like. So the PPI members were able to share whether or not the data represented what they were seeing in their own social circles and their own experiences in their local communities. And importantly, thinking about ways in which we might be able to help address some of these factors as well if we were to improve booster vaccine uptake in the future. And certainly we're now drafting a proposal to do thinking about intervention options where we're going to be able to co-produce these intervention packages with members of the public as well as policymakers, which is integral to the type of work that we do. So I hope that shed a little bit of insight in how we've involved PPI in kind of a rapid kind of quantitative project with scope for further involvement in terms of intervention design as we progress. And I would like to hand over to Dave now to share his perspectives of working on this and other projects within the unit.
Okay, Sylvia, can I have the next slide, please? Okay, there we are, the Magnificent Seven. This is a strategy group. We were formed about 3 years ago. We have 6 members. We have a national and inclusive representation, and our job is to comment not only on government health policies, but on unit projects and PRU-PPI strategy. Now, the unit's remit is behavioural science, and this means we look at the totality of healthcare rather than, say, focusing on one particular aspect. We've actually written a paper on how we formed the group and the difficulties we had and the lessons that we learned, and we have submitted that to an academic journal. Next slide, please. Okay, the vaccine project was one of several COVID-related projects which our group and the unit were involved in. The particular involvement pathway I've shown here for the vaccine project is very similar to the other non-COVID projects we've been involved with. COVID caused us two main problems. First, we were unable to get together to socialize as a group, and we solved this in two ways. First, by running our monthly meetings very informally. We used these meetings both as a social catch-up, and we also dealt with agenda items, and we also formed a very successful WhatsApp group. Secondly, we were dealing with a wide range of public health issues, and we needed a robust schedule of training. Now, some of this we could deliver by Zoom, for instance, ethics, plain English, looking at complex documents, but the more practical training, such as practical presentational skills and team interaction, we were not. As our research is nationally based, all project briefings and monthly meetings needed to be by Zoom anyway, so lack of a face-to-face meeting wasn't actually much of a problem. However, this did mean there could not be any researcher or strategy group joint away days and no social interaction between researchers and the group. But we solved this to some extent with virtual workshops. Next slide, please. Okay, what did we actually learn from this project? The first is that the group must deliver value. And in the case of COVID-related projects, feedback needed to be delivered rapidly. If we weren't delivering high-quality feedback and editing, then I think very quickly this leads to a loss of faith in PPI by the researchers, and it certainly doesn't do the wider PPI community any favors either. Secondly, the public need to be involved from the very beginning. And this continuous involvement not only means that the public have a much greater knowledge of the project, but it engenders a sense of ownership. Sometimes we call this the stick of rock strategy. If you have a look at the stick of seaside rock, you'll see that the printing on the rock goes right from the beginning right through to the end. And that's how we like to think of our PPI involvement. Next, it's vital that there's a relaxed, informal relationship between the researchers and the public. I mean, it's not so relaxed we all fall asleep, but we need to make this a partnership. It's a shared endeavor to deliver what the project needs. And we need a relationship where ideas can be shared and discussed in safety. And silly questions are fine, and extremely stupid questions are even better. For instance, in one meeting we had with the researcher's 8-year-old daughter gate crashed the meeting and insisted on doing a recital with her ukulele, which we all thoroughly enjoyed, and it was the way in which the meeting could relax and we could be more involved with each other. That's how informal our relationships actually were. Communication. That good communication is a lifeblood of PPI is so obvious, I mean, I won't even bother to dwell on it, simply to say that in PPI terms, absence does not make the heart grow any fonder. Lastly, we need to find out if we are actually delivering. So at the end of the project, our strategy group held an impact assessment meeting, which is really jargon for looking back on the project and seeing if you could do it better. Before we can move forward, we have to look back and see where we've been. If we can't measure what we've actually done, then we can't assess our impact, and that's important. So, I mean, what do we take away from all this? I mean, like all public research groups and everyone here, we're in the business of delivering world-class, cutting-edge research. That's why we're here. Now, I make no apology, well, perhaps a slight one, for being a tad too heroic here. But to quote a well-worn meme, this is the job we all do, and despite COVID, that's what we do, delivering world-class, cutting-edge research, delivering quality. Thank you very much for listening.